My name is Dr. Sarwar Chowdhury. I work in the London offices, so Stratford, Leadenhall, and the Romford clinic as well. And I'm an occupational health physician. I started in September 2019, so about 14 months. My role is to advise regarding health and work to the employer and employee, and I need to give it impartially. I undertake a variety of assessments, so from management referrals to medicals that are needed and required by law, as well as medicals for people that are about to start their new job. Health surveillance, so essentially just keeping an eye on people that have longer term conditions. And I also do pensions assessments, so people who are looking to retire on ill health grounds, as well as any calls with the employer, so employer pre-referral calls, so just a chat with the employer prior to any kind of assessment that they might have with the employee. Medigold is actually my first job in this specific field. I've been trying, I identified occupational health as a kind of a career path for me. And in my previous role, which is similar to occupational health, but not quite, I was a functional assessor in the past, but this is what I wanted to kind of do for the rest of my life. So I undertook the exam to become an occupational health physician, the diploma of occupational medicine, in my own time. And then I was like looking for a role, had a few kind of interviews, but I think Medigold in general I had heard as a very kind of supportive, especially for people who haven't done it before. There's a massive team, and they essentially only do occupational health, so it's a very specialist kind of company, something that I was looking forward to doing. And just in general, from speaking to people that are in the field, they mentioned that Medigold had a good work-life balance, a good variety of assessments, and it was run by the family, the Goldsmith family. And I think, you know, just having that feel of becoming part of a family and being a part of that feel, and it's not very corporate, which my old company was like, I found that was one of the main reasons. So when I started, did really well in terms of the support, had a lot of inputs because I needed it at the beginning, but Dr. Alex Swan, who's my manager, as well as Dr. Gareth Williams, the medical director, were really helpful. I'm now looking to do something called CSER training, so trying to get my specialist exams done and specialist status. So hopefully in the future, in the next few years, I'll be looking to do to become a consultant. So that's the plan. A lot of the reasons why I've just said. So I think the pieces of the puzzle just fit for me here. I think for me, there's a mixture of being able to progress in your career, but it's also the people, the way the teams work, the levels of hierarchy. So it's not just a clinical team, it's the non-clinical team. And I think in general, everybody's very happy at Medigold. I don't see a lot of complaints, and I think their kind of staff retention rate is really good for that reason. It's definitely one of those companies to consider if you're thinking about occupational health. For me, I like being able to spend a reasonable amount of time chatting to an employee or a patient, really understanding a bit more about how they are and what their life is like. I do a variety of assessments, which is useful, so I'm always being kept on my toes. But there's other stuff like the training, the seminars, the Zoom calls, that we have an MS Teams chat on the side, so lots of trainee conversations. And those are the kind of things, just generally day to day, just dealing with occupational medicine in lots of different ways. It's hard to say exactly what my exact favourite thing. I think I've stated a few reasons in the previous kind of questions. I think for me, if I had to summarise, I like the work-life balance. The support's been fantastic, and just having variety. I think when we talk about our working life, just in general, whatever job you do, everything can get monotonous at times, and you just want to be kept on your toes. You just want to have a bit of variety and really enjoy what you do. So that Medigold's made that for me. It's probably just over 5 words, but I'd say career goals and great work-life balance. I think those are the things that I would say.